My name is Fedor Panov. I'm an assistant professor of neurosurgery at the Mount Sinai Health System, and I'm the director of the adult surgical epilepsy program here. One of the biggest myths that we've been fighting in comprehensive epilepsy centers is the idea that epilepsy is just something you have to live with. We've learned a lot about this disorder over the past few decades, and one thing we know for sure is if medications do not work, if medications are not controlling your epilepsy, you should most certainly visit a comprehensive epilepsy center to look for other options. The dangers with epilepsy are many, and the main one that we always worry about is hurting yourself and hurting others when you have an epileptic seizure. Medications work in the majority of the time. But again, if the medications are not working, a comprehensive evaluation at an epilepsy center is something that can potentially really change the lives of patients with epilepsy. The next big myth that we have to fight is the idea that as long as the seizures are infrequent, that this disorder is under control and that things are okay. And that's a very difficult thing for us as a community to deal with, even if the seizure happens once a month, or even if they happen only a couple times a year. Each seizure is a potentially devastating event for the patient and for their family, especially if it happens out in the public or if it happens when they're driving. So we want to make this very clear. The seizures are not under control if they're still happening. Anytime you have a seizure that breaks through the current medication regimen, most likely the next appropriate step is to be evaluated by a comprehensive epilepsy center. We know that the majority of patients with seizures will be helped by medication. About 2/3 of the patients will start their first medication and their seizures will be under control. Unfortunately, what happens is if the first medication does not take care of the seizures and does not control them, and neither does the second one, the chances of any other medication working drops down drastically. So if you fail the trial of 2 medications for your seizures, the chances of the next one working are under 5%. And trying a new medication again and again and again, and getting up there and trying your 5th, 6th, and 7th medication, at this point is not worth it. The side effects of the medications are significant, and their possible benefit at that point is minimal. So the community has agreed that if you have failed 2 medications, you should be evaluated by a comprehensive epilepsy center to see if there are other ways that your epilepsy can be controlled. We have to fight the myth in the community that potential surgical treatment of epilepsy is the last resort. Some people still feel that every other avenue has to be exhausted and every medication has to be tried before we ever think of a surgical intervention. And I believe that that myth comes from several generations ago when epilepsy surgeries were for sure painful and difficult to deal with, and you need to spend a lot of time in the hospital while the workup was being done. They were incredibly demanding on the patient and the family. Over the last several decades, we really moved towards minimally invasive, both diagnostic and therapeutic procedures to be able to help patients with epilepsy. So epilepsy surgery, and especially the evaluation by a comprehensive epilepsy center, should not be thought of as the last resort option. You should be able to meet with the surgical part of the team early on in your treatment, and whether surgical intervention is needed or not, a comprehensive center will expose you to a variety of possible solutions to the seizures themselves. So to summarize it, once 2 medications do not work for your seizures, the team should be thinking about other options, including minimally invasive surgical options to help with your epilepsy. One of the main questions we always get is, will neurological surgery change me as a person? Will I no longer be the same as I was before the procedures? How irreversible are these procedures and how disfiguring are the scars? The community has made tremendous progress to, as best we can, keep these surgical incisions behind the hairline. So once the hair grows back, the incisions really, for all intents and purposes, are invisible. To keep the pain of these procedures down to a minimum. And of course, it's still a surgery, but we have gotten better at treating the postoperative pain and increasing the level of comfort of the patients. So we're continuing to move further and further into the land of tailored, specifically designed, minimally invasive surgical procedures that can be used to help your epilepsy. We've gotten to the point where some of the procedures do not change the way you are as a person and do not change the way your brain function. What they do is they augment the circuits that can potentially be responsible for suppressing your epilepsy, and they help those circuits. And at the same time, they interrupt the circuits that are responsible for generating your seizures. And those circuits then can come down, and those treatments get better and better as time continues. So it's another main myth for us to fight, that surgical epilepsy treatment is a dangerous, large invasion of your brain, and you will not be the same person. Those days are gone, and you will still be the person that you are after the surgical treatment is completed and after we've gotten you to be seizure-free. So what is the next step? What is it that you can do if you feel that your epilepsy is not sufficiently treated and is not under control? Well, we most certainly encourage you to reach out to a comprehensive epilepsy center that is in your area. Talk to your treating physician, to your primary care physician, to your neurologist, to your epileptologist. Talk to them about trying to get better control of your epilepsy. Most certainly feel free to reach out to our center, and no matter where you are in the world, we will be able to give you some advice and guidance regarding a center that is closer to you and be able to help you gain control of this horrible disease.